Has that made you think differently about your role as a veterinary nurse in terms of that stability?
I have been left reeling for a long time, actually. Again, it's not been quite a year since the redundancy. Now, if I approach a new job role, one of the first questions I ask is definitely around security. And, there is that sort of fear now ingrained in me about whether or not this is a job that could face redundancies in the future or job cuts or anything like that. And it's not something that ever occurred to me.
Welcome to The Consult Room, the podcast where we explore the evolving world of modern pet care. I'm Dr Paul Manktelow, a UK veterinary surgeon with a deep passion for pet health and welfare. In each episode, I'll be exploring key issues, challenging perspectives, and offering expert insight and practical advice. Because ultimately, my mission is to improve the lives of pets and the people who love them. Welcome back to The Consult Room. Today, we're tackling a topic that's becoming more common in veterinary conversations: redundancies. For years, we've heard about workforce shortages and the pressures on clinical staff. So why are we now seeing widespread job losses? After the pandemic, demand for veterinary services surged, and many practices expanded to meet that demand. But as things have settled, we're now seeing restructuring, redundancies, and difficult decisions being made, particularly within the larger corporate practices. So are redundancies the new normal in the veterinary sector? And what does this mean for those working in the industry, both now and in the future? To explore this, I'm joined by Annie Clark, a veterinary nurse with 17 years of experience. Annie is part of the Consult Room team and a regular guest on the podcast, but today she's here to share her personal experience of redundancy. She was recently made redundant as part of a corporate cost alignment exercise, and I know this is a situation that many in the industry are facing right now. Throughout this conversation, I'll also be offering my own insights into what's happening in the broader veterinary landscape, why redundancies feel unusual in this profession, and whether we need to rethink job security in the sector. Annie, welcome back to the Consult Room.
Thanks for having me back again.
I know this is quite a personal topic for you. Can you talk us through your experience of being made redundant?
Sure. It all happened very quickly. There was definitely not a lot of time from finding out that redundancies were going to be made to actually happening. I think the entire time span was 2 months. So really, really quick. There was certainly a lot that happened in those 2 months and definitely a lot to sort of unpack in that time frame.
So what were your kind of initial thoughts and emotions when you found out?
I think as a team, we were really shocked. I think that's fair to say. We knew that as a practice, we were doing really well. We were always really, really busy. It felt like for the most part, the workload was there. So it was a real surprise to find out that, our particular hospital was in line for redundancies. And definitely, I think the team overall was quite emotional, knowing that, we were really close knit, we got on really, really well, that people were going to have to leave forcibly, which is, not something that really happens in our industry, as I'm sure we'll discuss.
So how was the kind of the process handled? Did you feel supported by your employer as you went through the stages of it?
I definitely felt supported by my team, by the sort of the clinical lead in my practice. I felt very supported by them. The actual corporate themselves, I have to be honest, I mean, it was a process. I didn't feel particularly supported. It took a lot of time to get answers to any questions I had. And there was no sort of immediate point of contact for this. It was very much a case of, if you have questions, ask your line manager and then they'll ask the powers that be above. And so that whole thing took a lot of time, and you didn't really feel like you had that personal one-to-one support, which I think is really important in a situation like this where potentially, you're going to be made redundant involuntarily.
So redundancy is a kind of a common feature of businesses. If you look outside the veterinary industry, it's quite normal. But inside our sector, especially with clinical roles, it feels quite different, doesn't it, in terms of vets and nurse role? They have historically been considered quite stable, I would say.
I totally agree. In a sector where there's always work being generated, especially post-pandemic, where we had so many new pets. And as I say, we were a really busy hospital. It wasn't that we were finding ourselves having a lot of quiet times, a lot of quiet periods. And certainly as well, knowing that, nurses and vets, since Brexit, since we've had the workforce crisis, which we're still kind of reeling from now, it never occurred to me that me as a nurse of a lot of years of experience in an industry that is always got demand, I would even remotely face redundancy at any stage.
I've mentioned before that, the past few years we've heard a lot about workforce shortages in the veterinary sector, and yet now we're seeing job cuts. Do Do you think the shift is purely financial, or is there something bigger kind of going on?
It feels very financially motivated because I can't understand why there, or what else could be going on behind the scenes that could warrant, basically offloading a lot of experienced clinical staff. And it certainly wasn't myself within this hospital that that ended up leaving as a result of the redundancies. So it's a difficult one to answer, but I felt very financially motivated from my point of view.
And you said that the team that you work with were really sort of, a close knit team, and they sort of, banded together and got you through this really stressful time. But how do you think these job losses are affecting sort of the wider teams, both those who are being made redundant and those that are left behind?
I mean, I'm still very much in contact with the team that I have left behind, so to speak. And I think I do know that the impact was huge for them. As I say, it wasn't just one person that left, wasn't just myself. There was a number of us that left. And it actually impacted the structure of their business as well. For context, I was a night nurse, so I provided overnight care for their patients alongside another nurse. And they essentially then decided to outsource the night care to an external provider, which meant that they didn't have that kind of personal in-care piece for the overnight care of their patients, which clients did not receive that information well. So, there was an impact to their business in that respect. There was a lot of questions, a lot of frustrations from clients that they had to deal with. And also inevitably, and I say inevitably, but it certainly seemed the case in this instance, after the redundancies, a lot of people left of their own volition. So the team wasn't just impacted by the redundancies, it also then suffered a knock-on effect by losing even more staff. Probably, and I can only assume, because there was that feeling of not feeling safe and the fear that this potentially could happen again following year or down the line.
We said before, didn't we, that traditionally, these kind of roles, some nurses and clinical roles have always felt quite stable. Like you say, there's always demand there. There's always pet owners and animals that need treatment. Has that made you think differently about your role as a veterinary nurse in terms of that stability?
I have been left reeling for a long time, actually. And again, it's not been quite a year since the redundancy, but now if I approach a new job role, one of the first questions I ask is definitely around security. And, there is that sort of fear now ingrained in me about whether or not this is a job that could face redundancies in the future or job cuts or anything like that. And it's not something that ever occurred to me my entire career up until this point. It was a side thought, yeah, it's been a bit of a eye-opening experience in that respect. And I can imagine for nurses or new that have just qualified or new grad vets, hearing about these redundancies must be slightly alarming for them who are just starting out in their career.
Can you talk about how it's affected you kind of emotionally through this process as well?
I mean, sure. I mean, I'm a mum. I have a mortgage. I have bills to pay. The uncertainty through that period and not knowing what was going to happen opened up a lot of concern about what was going to happen to me and what was going to happen financially for me following on from this. And certainly finding another job, having had childcare concerns. For me, I've worked nights personally for most of my career. And we all know that whilst there is night work out there, it's not as easy to come by as day work, especially the local and that can work around your children. So, I was in a job that worked perfectly for me on a personal level to then suddenly floundering, looking for something that could hopefully fill in that gap short term, which I did manage to find, but it came at a cost. And I have to say, I was quite bitter following on from my redundancy. I feel like I probably still am a little bit because I left what I felt was a perfect job and I didn't want to leave, and then put into a situation where I'm kind of making it up now and not necessarily doing the best nursing as a result.
And it was interesting you said before about the positioning of the redundancies were financial. It was talking about the need to cut costs. But was there any sort of acknowledgement given to patient care or animal welfare throughout this, and any sort of assurances given to the teams that this had been considered as part of the redundancy process?
There was never any mention about how this might impact the business. It was very much an exercise of where it was disclosed to us as a team that a particular figure had to be met in terms of salary outgoings that had to be cut back from. There was no discussion around what that could mean. And certainly there was an instance where a manager of mine did say to me that the night team was very much on their radar to go. And if we didn't take voluntary redundancy, it would almost certainly be that we were made compulsory redundant. was always a kind of a silent discussion. It was muttered about in corners what that could mean and what that could lead to. And of course, when you're sort of that person sitting in that position, that's really tough. And I know that the people I've left behind have been left reeling from that loss and not having that service anymore.
And going back to sort of welfare generally, I mean, we talked a little bit about animal welfare, but there's also the mental well-being of the people that are working in these situations. And, from my perspective, veterinary care is a team effort. When roles are cut, the workload can increase for those that remain. So you can see longer waiting times, reduced appointment availability, and kind of more pressure on remaining staff. And we've already seen similar issues in human healthcare where reducing staffing levels can lead to burnout and lower standards of care. So do you think there's a risk that veterinary medicine could be heading the same way?
I think now that redundancies become a sort of obviously a very palpable feature of veterinary medicine, I think now you're going to be in a situation where people who have previously assumed security and job security are therefore no longer going to have that as a guarantee. Will that then mean that they move on more often? Potentially, or will they leave the profession altogether because it no longer feels particularly safe? So then, of course, that will have an impact on animal welfare and the team as a whole, because you're suddenly all kind of very much tiptoeing around the fact that there could be a redundancy around the corner.
So, I mean, in the majority of cases, I would say, in my experience, redundancy is really quite emotional and quite stressful for people. And especially if you're facing redundancy and you're uncertain about the next steps. There is a flip side to this that, the sector is evolving and redundancies can be a setback, but actually they could open up new opportunities. We are, as a profession, exploring new ways and new opportunities in how we do our work. So is this the case for anybody like yourself or people that have gone through this experience, that it has opened up new doors for them and it has given them opportunities to think about where their career's heading?
I mean, certainly I can speak about some of the people I know left. They left the profession altogether. So and some of them are really, really happy in what they're now doing, which you could say is great for them, that they've rediscovered a new passion. But actually, we've then lost them from the industry. So is it a positive thing? I'm not so sure, to be honest. From my point of view, it pushed me into going into referral medicine before I perhaps would have done. And whilst it's not for me, as it turns out, it was great to have the experience. And for that, I am grateful. As a result, I'm now moving back into ECC, which is a world that I love and I'm very familiar with. But yeah, as I say, certainly from the experience I went through with the people that I know left, a lot of them have left the industry, and I'm not so sure that's a great thing.
Yeah, that is a concern, isn't it? Especially where, the usual business models are, you might have to restructure your team, but then you bring new people in at a time when the business is sort of growing. But as you're saying there, we are potentially losing people, highly skilled people from the profession who, go through this experience and just think, do you know what, there's lots of other reasons that feel like I'm being pushed out of a profession that I used to love. I'm just going to go and do something else. And we've lost those people forever. So is that a risk, do you think, for these businesses that then are thinking, oh, as we get busy, we'll just rehire more people? Where are those people?
Absolutely. I mean, we already know, as we touched on, that there is a workforce crisis going on within the industry. There aren't really enough vets and nurses for the volume and the number of animals that are pets in the UK. So to lose anybody because of redundancy feels like a huge waste. And as you say, when it comes to rehiring, where are all these people? Where are we going to pluck them from? They're just not going to be there. And as I say, that's when you see smaller teams that experience burnout quicker, potentially, and then animal welfare then suffers as a result. I think that it's not a business model that I think is a good long-term plan. I don't think they should be looking at making redundancies as a regular thing. I really don't. And I know that some of the corporates, I mean, certainly the one that I was working with, this wasn't their first rodeo. This wasn't the first redundancy sort of consultation they went through. There was a couple prior to that. So I just hope it doesn't become the new norm for the sake of our industry, really.
Having been through this yourself, what kind of advice would you give for people who are finding themselves in this situation?
Firstly, talk about it. Talk to your colleagues about it. Don't let it become a taboo subject that you have to keep to yourself and close to your chest. I think talking about it really helped me. Again, I guess it depends on the dynamics of the team that you work with. But if you have a good dynamic and good team relationships, then it's definitely worth talking about with them and kind of understanding how you all feel, because it's a guarantee that you're all probably feeling the same way. Asking lots of questions. Consider a union. Now, in the veterinary industry, we don't really, unions aren't really something that we've really had to consider or have certainly in place, and that's now changing, which is great. But now we've got the BVU, which is a veterinary union that you can join and that can help provide advice for people going through this. And there are lots of other support avenues within the industry that we can tap into. And again, as you say, it's a very highly emotional, very stressful situation to go through at life. Give them a call as well. I'm sure they can point you in the right direction if you are struggling with those kind of emotions.
Yeah, people need to find those avenues of support. I think that's the first and foremost thing in that situation, because it is highly emotional. But I think it's also important for people to understand their rights as well. As you mentioned, the union there can help, but I've always found ACAS very useful as well. They're sort of not specific to the veterinary sector; they are generalists, but they give lots of employment advice out. Just in terms of how you feel sitting right now, you say it's almost been a year since you went through this process. You went, you found another job. How has it left you feeling about veterinary nursing and the wider veterinary profession?
I think I'll always love veterinary nursing. I don't think you could do it for as long as I have done if you didn't have some passion for it. It's tainted though. And that's because of job security. Again, that's not something I ever thought about or considered, certainly in my younger career. So I hope that, and I'd love to think that these big changes that are made and that going through these processes would be for the greater good. I'm not convinced at the moment, and I hope that down the line we start seeing some benefit to these consultation periods and to these redundancies. So I think going forwards, I'm just going to be very careful about where I go and who my employer will be. I'm keeping this in the back of my mind all the time. And I think that's my advice to anybody that's now in the industry or looking to move jobs is just to be aware that this is now a feature of the industry. Like you said, it's something that happens in lots of other industries out there. It's not something we are familiar with in the veterinary world, but I think we need to start being familiar with it.
And do you think, having gone through it and having this presented to you in such a purely financial way, has helped you understand the financial pressures of businesses a little bit more? And the reason I'm asking that is because I found over the years, working in a purely clinical profession, that we're very focused on animal welfare, patient care, but not necessarily have very good wider perspectives of how businesses run and how financial models work. Do you feel you understand that a bit better now?
To be honest, in this situation, not really, because as I say, we were told that we were one of the top performing hospitals and we were doing so well. So it was, like I said, very blindsided by it, to be perfectly honest. I think if there'd been more discussion and more explanation about why they felt that these costs needed to be made, these cost cuts needed to be made, it might have taken the edge off, may have understood it a bit better. I didn't leave there understanding why job cuts had to be made. I think there should have been more discussion and more open communication about that, especially where you feel like you're in a very safe place and you're succeeding at what you're doing.
Having gone through this, have you got any advice for anybody who may be either worried about their job or indeed facing a redundancy situation right now?
I think if you're worried about your job security, go and speak to somebody, a line manager, practice manager, whoever it may be that has that that could have that information. If you're worried about how busy your practice is and how much work volume you're getting and all that sort of stuff, if you're worried that there could be risk to your job security, I think always go and have a chat with someone who could perhaps give you more information. Is there something in the pipeline? They may not be able to tell you everything, but at least give you some indication or alleviate your fears entirely. I think if you're facing redundancy, understanding what your rights are, as you say, and understanding what the difference is between voluntary and compulsory is really important. So for me, that was critical to my decision, especially as well that it was indicated that the night team would be sacrificed, for want of a better word. So I took voluntary redundancy because it meant that there was a better severance package as opposed to if I'd taken compulsory, which gave me a bit of breathing space in order to find another job. So understanding the difference is also really important.
Okay, that's really, really helpful. Annie, thank you so much for sharing your experience and insights. And I know redundancy is a really difficult thing to go through. Hopefully this conversation will help others who may be in a similar situation and help them feel a little less alone. To everyone listening, I'd love to hear your thoughts whether or not redundancies have affected your workplace and whether or not you think we're seeing a shift in job security within the veterinary profession. As Annie mentioned there are lots of resources out there to support you. Consider contacting BVU, the Veterinary Union, contacting ACAS for advice, and of course, reaching out to VetLife or friends, family and colleagues for support. Thank you for listening to this episode. You'll find all the relevant links to this conversation in the show notes. If you enjoyed it, please follow us and leave a review. It really helps other people discover the podcast. For more insights on topics like this, you can connect with me on social media at Dr Paul the Vet, or check out my website, theconsultroom.co.uk.